Don't get the feel.
Hey there, Facebook. It's Dr. Lichten here. I've got my lovely assistant, Rachel.
Hey guys, it's Rachel. I am the office manager and also have the privilege of being Mrs. Lichten. So I am taking over Facebook today to talk about virtual consults. These are, they've been around for a while, but they are new to us and probably new to you. So we thought we would show you how to schedule a virtual consult, what it looks like, and then what will sort of happen once you and Dr. Lichten get to talk virtually. So the first thing we do...
Obviously, if you're not in the same room together, we're not going to be that. We are today, just for the sake of doing this, but we are on separate computers here. So Rachel's got hers loaded up here, and I've got the one loaded up here. So
I would start out by sending Dr. Lichten an email and saying, hey, I want to discuss whatever it is that you want to discuss, and these are the dates and times that I'm available. Now, in my world, we're here all the time. So anyway, I would pick a couple of dates and times. He will send me an email back, picking a particular date and time, scheduling an appointment, and then he will send me an email with a link.
So you'll be able to click directly on the link, but Rachel's going to type it in here. It's doxy.me/Central Ohio Plastic Surgery. So she'll load that up. It brings you to the screen. All right. Let me see that there. It says check in to let us know, Dr. Lichten, you know you're here. You enter your name. Right.
I type in my name, I click check in. Now, you have to enable your camera if you have it covered over like I usually do. You'll have to uncover it. And it wants to use your microphone, which again, we're going to have to allow.
We will end up muting the microphone just because we're in the same room. So, did you click enable camera?
I did. But, you know, sometimes these things will go more smoothly than others. Yay, Facebook Live.
All right.
All right, maybe we should talk about something else.
while we technical difficulties. Now, usually this should work.
All right, well, we're checking in without just...
And you'll be able to enable a camera hopefully here shortly.
And Dr. Lichten has done a few of these already, and...
They've gone a little smoother than this. All right, there we go.
It is. I guess my camera is enabled.
All right, so this is your the welcome screen. Says we'll start the video call in a moment. Now, normally you're going to be able to see, you got the little microphone up here. Rachel's actually going to mute that right now.
Okay. There we go. We're going to try it again. Check in.
Your computer will work much more smoothly than ours does.
There it is. Right. Look at all that. All right.
So, just for sake of right now, the three dots. You will not do this at home. Rachel's going to mute herself just because we're in the same room. We don't get feedback. All right? So Rachel's here. I've got a screen, essentially, here on mine that says, oh, I've got Rachel twice in the waiting room. But I'm going to let her take this on hers. I'm going to accept her call here. Pardon the feedback for a second before I shut off the microphone.
Hey, there he is. Ooh, yikes.
All right, so now that I've muted, we should be better. Okay? So, and this is as simple as it is. Now, obviously, we won't be in the same room, but we'll have a discussion here about whatever bothers you. If it's skincare, if it's fillers, if it's Botox, we can talk about all those things. Skincare, obviously, is a big part of everything that we do. And so, you know, that's something we can continue to do. We can mail that out to you once we figure out and pick a regimen that is right for you. If we're talking about Botox or fillers, we'll be able to say, okay, Rachel, lean a little closer to the picture. Let me see a couple things closer.
And so what he will be seeing on his screen,
essentially, is the opposite of what you've got there.
Which is terrifying from this angle. Yikes. Okay.
So we'll review those things and go over whatever treatment plan. If we want to talk about surgery, if we want to talk about body contouring surgery, there are things we can do. Obviously, most of the time you're going to be home. If you're looking at something like a tummy tuck, you can basically expose.
We can stand up.
pull up, expose, see where
Yeah, I'm
we are.
not doing that for Facebook.
But we'll have you wear your undergarments stay on. You can wear a bathing suit if you're more comfortable with that. We can also, if you're more comfortable, just have you take pictures and email them.
Sorry.
If we're talking about breast augmentation, now most of these things we'll talk about the general ideas of surgery. We may actually even pick a date, but we are going to do an exam, do some accurate measurements in the office so that things like picking the right size implant, we can do more specifically when we get closer to the time of surgery. But this is our opportunity to continue to see you, to talk with us while we've got downtime. You know, it's nice that you don't have to take time off from work to come in. You can just take a half hour, out of your day. We'll set up a time. We'll be able to review whatever questions you have. Because we're all in this together, there is no charge for these virtual consults right now. I want to make sure that we are here to be able to continue to serve you, to be able to continue to answer your questions, to educate you about what's important, what bugs you, what we can do, and who we say, you know what, this isn't the right idea, this isn't the right time. Or you may say, look, I've got a couple months before I want to do this, what do I need to do now? We actually can also, so consults are free for cosmetic purposes. If there are things that are insurance related, we can do insurance consults as well, depending on the specific indications and what sort of referrals or things we have there too. So things like skin lesions that look funny, this gives me a chance to see them and say, hey, you know what? Let's schedule a time to bring you in the office one-on-one because I want to do a biopsy on that. If there's things that bug you, we can do that. Other things, Rachel, what else am I forgetting to tell you?
Well, I am taking this lockdown opportunity to work on my skincare. Although I have access to all of it, I'm not as good and diligent as I should be, so I am going to take this opportunity to really focus on getting in my skincare routine, working on a regimen. If that's you and you want us to ship you the products, we're happy to do it. We will not charge you for shipping, just because we think skin health is important. So you can send Dr. Lichten an email, dr.doctor@ohioplastic.com, or you can leave us a voicemail, 740-653-5064. We do check that at 2 o'clock every day. Now, I can't promise that the stuff's going to go out the next day because there's not someone in the office every day right now, but we will get it to you just as quickly as we can, because that's what we can do right now for you. If there's something else you guys want to hear about on one of these Facebook Lives, let us know and we will be happy to. Dr. Lichten loves a good Facebook Live, me not as much. I think that's it, Facebook.
All right. Be safe, be well, let us know whatever you need, and we will see you all, hopefully in person, but at least virtually, soon.